Because of our relatively soft and sugar-filled diet and many other factors, dental decay affects most people. However, with some effort on your part, decay can be prevented or at least reduced using some quite simple measures. Dental decay is one of the most commonly occurring infectious diseases of humans, and it progresses at an alarming rate if not controlled. Although preventive methods are well known by you, it's almost impossible to completely prevent the occurrence of dental decay. But you have the potential for a fast rate of dental decay that should have some extra preventive treatments to reduce or eliminate the problem. Let's see what can be done about it. Many oral conditions can create higher than normal amounts of decay, and there are numerous factors influencing the high decay rate. Some of the factors stimulating high decay rates might be well known to you. Let's look at them. Patients who continue to eat a sticky, sugar-rich diet. People with a dry mouth, taking many medications. I have patients in my practice taking up to 20 medications, and they often counteract one another and make the mouth really dry. Older, ill patients. Patients with inadequate oral hygiene, and that could be any one of us. Now, I know you or your friends may have had chemotherapy or radiation therapy. 100% of people going through radiation therapy of the head and neck will get new dental decay, and 30% of those going chemotherapy will get new dental decay. Bulimia is almost an epidemic in the United States, and those people who have acidic liquids on their teeth routinely have very high decay rate. Crystal meth users, that's an epidemic also in the United States. They get decay rampant. Special needs patients who for some reason cannot clean their teeth well. They may be physically or mentally debilitated. People going through orthodontic therapy have wires and brackets on their teeth. They almost can't avoid getting decay. And nursing home patients. Often they're ill, they're unable to clean themselves well. There are many, many reasons for extra decay beyond the level that you would expect during your typical lifetime. What can we do to prevent tooth decay? You probably know this, but let's repeat it. Dental decay is caused by leaving a slimy, acidic residue on your teeth, commonly called dental plaque. You can take your fingernail and scratch it off. The arrows on the image indicate that this patient has had a significant amount of plaque on his teeth that he hasn't cleaned off. Cleaning the plaque off your teeth at least once every 24 hours can be effected easily by numerous methods that you probably know well, such as toothbrushes and floss, but many people just don't do that. However, assuming you are already doing your best to clean your teeth and decay is still a problem, what can you do? On this image, you also see some solutions. Are there other methods to help your teeth resist decay? Although there is still some controversy about fluoride use to prevent dental decay, as there is with any public health concept, use of fluoride has had more positive, supportive research than any other public health measure in the history of all health research. For more than half a century, it's been known that fluoride, either taken by mouth as a child or applied topically to the surfaces of the teeth any time in life, can greatly reduce dental decay. That conclusion is scientifically proven knowledge, irrefutable. Are different concentrations of fluoride used? And do they have different success rates in decreasing decay? The two toothpaste brands contain about 1,000 parts per million of fluoride. They're what you buy anywhere you go for toothpaste, a variety store, a pharmacy, a grocery store. The other image has solutions and toothpaste containing up to 5 times the fluoride as your normal toothpaste. In some countries, they are prescription items. It has been proven for decades that these concentrated fluoride gels containing about 5,000 parts per million fluoride applied routinely to the teeth can reduce or eliminate active decay such as yours. To be most effective, they are applied to the teeth in a specially fitted applicator made by your dental professional. Placing gel in these custom-fitted trays that fit your mouth and teeth exactly allows the gel to contact all surfaces of the teeth, thereby strengthening the outside enamel of the teeth and providing some resistance to dental decay. It has been suggested that the fluoride should be applied at least once per day. The most appropriate time is just before going to bed, thereby allowing the fluoride gel residue to be on the teeth for a part of the night at least. For extreme cases, it's been suggested that the fluoride treatment should be applied also after breakfast for a total of 2 times during the day. Is the procedure difficult, time-consuming, or painful? No, on the contrary, it's simple. It requires just a few minutes, and it's not painful. Let's see how this effective treatment is actually accomplished. Usually you will have a brief appointment with one of the clinicians in your dentist's office. During this appointment, you'll be informed about the details of the treatment and how to accomplish it in the privacy of your own home. The dental professional will make the plastic trays for you and show you how to use them. The dental professional has made a tray that fits over the top of the patient's model, and it should fit the mouth in exactly the same way. There will be 2 trays that have been made, one for the lower arch, one for the upper arch, assuming you have teeth on both arches. That tray should fit down onto the gum tissue and seal as it is placed. Now, they fit well, it appears. The dental professional will take them out and see if the patient can put them in. The patient is now trying them in the mouth, and it appears that she did that very well. And they've gone down into place. Now they're taken out and blotted and dried. This is the same thing you will do when you're using these trays. They should not have a lot of saliva or water in them, or you will have a dilution of the fluoride, which is about 5 times as strong as a normal toothpaste. After blotting the tray dry, a few drops are placed in. Usually it takes about 6 to go equal distance all the way around an arch. The patient now sucks the saliva in her mouth and swallows it, and the trays are inserted into the mouth. This is the same way the patient will do it, and that tray fits so well that that material goes everywhere. It'll feel cool to the patient, and that now is going to go into the external layers of the teeth and provide a very significant amount of fluoride uptake. Both trays would be placed in and allowed to remain for 5 minutes. As we said, this could be done either once or twice. I prefer twice during the day, once after breakfast, and most importantly, once just before bedtime. The trays should be stored in a place where they're safe, and should be cleaned out before storing. If you are living in a geographic area with fluoride in the water, check with your dentist. You should expectorate or spit the residue out of your mouth, and then rinse with water to remove the remaining fluoride gel residue. You don't need any more fluoride if you're drinking a lot of water in your area. However, if you're living in an area which does not have fluoride in the water, then you would expectorate the excess fluoride gel and leave any small amount of fluoride gel in the mouth to dissipate on its own. In other words, don't rinse. The trays are then washed, as I said, dried with tissue paper, and stored for the next use. I'm quite sure that you would like to reduce or eliminate, if possible, your continuing dental decay challenge by using the simple procedure you just saw. Once or twice a day, you can do just that. I've seen it over several decades. Your dental professional will provide additional information on the concept, so please ask questions of the dentist or the dental hygienist or dental assistant. I wish you success in overcoming this frustrating problem.